Thank you so much, Miss O. What's good, everybody? It's been a while since we've been here on Y&D. At one point, we couldn't have the session because we had faced network challenges as a nation. And then we also had to break for Easter holidays the following week. So we are here today, and I am so excited. Saturday, 6 April 2024 is the date, and thank you so much for being here with us. Please kindly use the chat box to tell us how your Easter holidays were, how you're doing, and where you are connected from. It would be so awesome if you guys could just tell us how you spent your holidays. Ladies and gentlemen, speaking to you is Praise Shito, and I am your MC for today. And yes, I am connected from Harare. Welcome, dear Dynamites. It's time for Young and Dynamic. To our respected HLF, Delta staff, and executives in the house, thank you so much for being here. We welcome you, we love you, and we appreciate you. Thank you so much for gracing us with your presence today. I hope that the little break that we had did not make us forget our housekeeping rules. As always, please do remember to make sure that your gadget is on mute at all times, unless if you've been asked to speak by the facilitators. Please do use the chat box to comment, to make any contributions that you want to make. We have a team that is in the background that is taking note of each and everything that you send through the chat box. Let me kindly ask Petunia Moyo to lead us in a word of prayer. Over to you, Petunia. Hello, Petunia, are you here?
Good afternoon, everyone. Am I audible?
Yes, we can hear you.
Good afternoon, everybody. I hope you had a wonderful break. I'm going to take you for the prayer session today, and we are going to get our scripture from 1 Kings 15, verse 3, which says, "You hold in all the sins which his father did before him, and his heart was not wholly true to the Lord his God, as the heart of David his father." So our prayer points for today are have a whole heart towards, or I'm going to pray. Our Heavenly Father, we come before you this afternoon. I pray that you guard our hearts to be loyal to you as always. I commit the heart of everyone who is listening today. Purify us, O Lord, cleanse us, O Lord. We confess everything with our hearts which are against your will. Lord, we thank God also for the rain. In Jesus' name we pray, amen.
Amen and amen. Thank you so much, Petunia, for such a wonderful prayer. Thank you so much. So today we are focusing on our health with the theme Level Up Your Health Game. We have Dr. Tawanda Zvakada in the house and is going to be taking us through this session. Dr. Tawanda holds a bachelor's in medicine and bachelor's in surgery at UZ and is a general practitioner at Gurube Medical Center and is also a JNSF alumni. Please help me to welcome Dr. Zvakada onto the platform so that he takes this moment to speak to us. Over to you, Doctor. Hello, Doc, are you here? Okay, let me leave this time to Pastor Mnashi.
Oh, perfect. Thank you very much, Praise, for awesome and wonderful facilitation and just letting us know what has been happening. Indeed, it's been 2 weeks, actually. We had Easter, and before that, we had a challenge with network across the country. And we couldn't just have the session. We had to cancel the session. So I can see that doctor is in. I'm not sure if he can hear us, but I've asked him to unmute. So Doc, you can unmute. I'm also asking you to switch your video. You can also try and do so. I know it's raining in Guruve, and in Harare, it's also raining cats and dogs. And I hope that our network won't give in on us. So we're going to try Doc once again and see if he's going to join us, if he's going to be able to unmute and to switch on his video. So while we are doing that, we'll just get on with the conversation. We'll start by the definition of what health is. We are always talking about health. But what is the definition of health? So I want you guys to write in the chat box, what is the definition of health, the way you understand it. Now, I know that most of you are going to AI the definition. That's okay. You can AI it, but before you AI it, can you please give me your personal definition of what health is? Okay, Zimbabweans want to say healthy living. What is healthy living to you? Tell me what that healthy living is. Is it being on a cruise ship somewhere in the Bahamas or in Durban or in Dubai somewhere, living your best life? What is healthy living to you? Can you please just write that in the chat box and define it for us? That is the first thing that I'll ask you to do before we can move on to the second thing that I'm going to ask you guys to define as we try to get Doc to come through and talk to us about what these basic things are. So can I ask the host, Dr. Tawanda is back. So host, can you please co-host him so that he will be able to unmute himself and to switch on his video. Doc, you can start by switching on your video. And then there we go. You have been co-hosted. There we go.
Thank you very much. I hope you can hear me well wherever you are.
Yes, we can hear you well and we can see you very well, Doc.
Thank you very much. I was having some technical issues, but I think they are now sorted out. Like you were saying that it's raining today, but for today I'm not in Guruwe. I'm in Harare and I can see it's raining. I've actually failed to get outside the car to a spot I was intending to share with you this presentation, but I will be sharing from the car. And when the rain is stopped, maybe I can you can allow me to move outside. So maybe you can share with others the presentation I shared with you. Because this is really an interesting subject, primary health and secondary health. It's very important for everyone to understand this because it forms the basics of health care for every nation. So it's really, really important for us to understand this. And I'm really passionate about this topic. I actually get goosebumps when I'm talking about this because these are just pertinent issues that need to be addressed from time to time. And the cost of doing so is very little. It's mainly to do with how passionate someone is. Yeah, so I can see that the presentation is coming up. Yes, thank you. So I understand it's going to be about 30 to 40 minutes presentation. Then afterwards we'll be having questions. I think we'll need to spare more time for questions. because this information you can always find it, but for questions we need to be able to answer these questions. And I also have a team of doctors that have agreed to join me on this platform. I can actually ask them to chip in from time to time. I hope Dr. Mishek Ruwende has joined. He's very much passionate about primary healthcare. He actually have got it's very active on many social media handles, and I encourage you all to follow him, because he posts almost every day on issues that we'll be discussing today. Having said that, you can move to the next slide. The presenter had asked everyone to look up the definition of healthy, and I hope you have all got it correct. Because health is a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. This is according to World Health Organization. And most people just think that if they are physically well, they don't have any injury, or they are not having any pain, they think that they are healthy, but it's not only about that. We also need to consider mental health, you know, and your social well-being. That's when we can actually say that this person is healthy. So, having defined healthy, we'll go on to define what primary healthcare is, because it is the basic, it forms the basics, because we have primary healthcare, we have secondary healthcare, tertiary healthcare, and some even go on to mention quinary healthcare, which mainly focus on research and the likes. But today we are mainly going to focus on primary and secondary. So by definition, primary healthcare is defined as essential healthcare made universally accessible to individuals and families in the community by means acceptable to them through their full participation and at a cost that the community and country can afford to maintain at every stage of their development in the spirit of self-determination. So that's the definition of primary healthcare. But to simplify it, it's just whereby we'll be using the resources we have. This one doesn't need to be expensive, doesn't involve many sophisticated equipment or anything. This just forms the basics, you know, and it mainly focuses on prevention, preventive methods. Like if you go to a local clinic, it's actually the perfect setup for a primary healthcare. A local clinic, we expect you to get your immunization, whereby you are preventing a disease before it actually happens, or you are getting, oral rehydration solution. These are some things, the basics that you can just get from a primary healthcare facility, or condoms is another example, where you're just trying to prevent a disease before it actually occurs. So this one, everyone has to have an access, and actually everyone has access to these things as long as you have got the determination to do so. You are able to get these because they mostly come at no cost in public institutions, and even in some private institutions, these services are even provided for free. So maybe we can move on to the next slide. Yes. Yes. So as we've been mentioning, primary healthcare is characterized by partnership and empowerment by the people that shall permeate as the core strategy in the effective provision of essential health services that is community-based, accessible, acceptable, and sustainable at a cost which the community and the government can afford. The concept of primary healthcare as a strategy to reach the goal of health for all. So as you understand the universal health charter, which states health for all. So these programs are in public institutions are supported by the government, whereby everyone needs to have access to HIV testing. As long as you're willing, you can get an HIV test, and you can also get their treatment, their antiretroviral therapy from the clinic. This is all funded by the government and supported by the government. So these are national programs that will be going on, supported by the government. So as long as you are willing, you get access to this. Yes. Okay. Sorry.
chinoitwa mwedzi woga woga chekuchenesa nharaunda pachete chinobatsira kuti nharaunda dzigare dzakachena.
So are we together? Sorry for that.
Yes, we
Doc,
are
we are
together.
following.
Okay, thank you. So we'll move on to the modern concept of health, whereby we have optimum health level of functioning among individuals, families, and communities. So, when someone is not healthy, what's easy to notice is that they tend to isolate themselves and they are not performing to their optimum level. So the modern concept of health is when you have individuals who are performing at their optimum level in families and communities. And healthcare is defined as prevention, treatment, and management of illness and the preservation of mental health through the service offered by the medical, nursing, and allied health professionals, your sonographers, your radiographers, and the likes. So all those things constitute what we term healthcare. You can move on to the next. All right, you can skip. It's just a repetition. Yeah. So this is what we're mentioning to say that primary healthcare is essential healthcare that is based on practical, scientifically sound, socially acceptable methods and technology mode, universal accessible to individuals and families in the community through their full participation and at a cost that the community and country can afford to maintain at every stage of its development in a spirit of self-reliance and determination. So when these services are distributed outwards, they have been scientifically tested and they've seen to work. Like when there's a national program to give out condoms, they will have been proven to see that they reduce the risk of people contracting STIs and HIV by a great percentage. So as long as someone is self-determined to have these things, they can always get from a local clinic. And in most setup, I understand there's a local clinic that will always be close by. I understand we have people from different regions, Burundi, Botswana, South Africa. And I'm sure the model of healthcare is always similar, especially here in the Southern Africa. Might be an issue of resources and but the model is similar. So I'm sure it applies everywhere. You can just walk into a clinic and say, I want this. I want my BP to be checked, and all these things. And even at community level, there's a drive to distributing out mosquito nets to prevent malaria. And because the focus is mainly on prevention of illnesses before they occur. And there will be even programs to spray for malaria prevention and the likes. So people just need to be able to take on these things, and they'll be fine. And maybe we can move on to the next one. Okay, we can move. Okay, move to the next one. Move again. Yeah. So we will be looking at the characteristics of primary healthcare. I hope you are able to see this slide. I understand it's small font, but it has got very important information. Because primary health is characterized, it is essential healthcare which is based on practical, scientifically sound, and socially acceptable methods and technology. So these things they will have been researched on for quite a number of years to say, these things they work, this one doesn't work. This now we can now give to the public. That's when you'll be hearing that we now have a vaccination for COVID, and it will be safe by the time that will be distributed to everyone. And the encouragement is for people to take up these vaccinations because they work. Science. Good thing about science is it can be proved, and it works. So and it should be rendered universally. It's acceptable to individuals and the families in the community through their full participation. So I will give another example of, I will give that same example of COVID when it came. Worldwide, people were vaccinated for COVID, and it was just a matter of people saying, I want to be vaccinated. So when we take up these things, we improve our health. But then you always find some people who are against vaccines, and they'll discourage people to say, don't take these vaccines, which is not a good thing, because these simple but basic things go on to save lives, and by just preventing those when we speak on these issues like this, we know what will happen when people don't take up these things and they go on to get COVID, and you now need a ventilator to sustain you. And as a nation, we don't have that much resources. So the best will be just for someone to take up a vaccine. And the other point is its availability should be at a cost which the community and country can afford to maintain at every stage of their development, and spirit of self-reliance and self-development. So that's the other issue, to say when government is coming to support these programs, they have to look at things which work, but things we can also sustain. Because there are a lot of drugs on the market, and some are quite expensive. The side effect profile might be good for some drugs, but then for low resource setups, we might end up getting drugs which are safe but might have some side effects. But it's better for someone to have drugs and get their HIV or their chronic illness controlled at a cost that is affordable to them. And at times they're even given for free. You say, just have take your art. Because it can be expensive. Not that that will be the only option on the market, but that's what will be affordable and sustainable. Because the whole thing is for these programs to be sustained. Not for someone to then come tomorrow and be told, we no longer have this, we no longer have this. So we need to be aligned with our resources. And another characteristic is that it requires joint efforts of the health sector and other health-related factors: education, food and agriculture, social welfare, animal husbandry, housing, rural reconstruction. So the primary health, since it forms the basics, like I'll give another example of cholera. For us to be able to say we are combating cholera at a primary health level, we need to be integrated with other sectors, like education, to say people are educated, or else they're at school, to say cholera is spread in this way and in that way. We can prevent it this way. And we also need your local council to supply clean and accessible water to every household, so that we do not have a case whereby people don't have access to clean water, and whereby we can chip in as well to say we can give you tablets, which sanitize the water, but some basics that need to come from other. Those alone you can't do it on your own, so you need support from other sectors, whereby you can have reconstruction of modern houses and even blade toilets in the rural areas. They go a long way in preventing diseases. And even in schools, we can take advantage whereby kids are already gathered at one place, then there can be mass vaccination of children, and we have prevented polio and the like. Also, we're now trying to eradicate some of these diseases for good. Yes, we can move on. All right, we can move on. So move. Can we move to the previous slide? To the previous one. Yes, that one. So the primary healthcare reflects and evolves from the economic conditions and social, cultural, and political characteristics of the country and its communities. So you find that some diseases that we battle with in low resource setups, or in low to medium income countries, they are a disease of the past that in high income or first world nations they don't even see from time to time, like cholera. In the books, it's actually stated that it's a disease of I'm trying to avoid the word corrupt governments and the like, but I find in countries where the government is just providing good sanitation and the like, you don't get to see cholera. It's only in cases whereby there's no proper sanitation and there's no clean water and the like. So this primary health care is if you are to say it's mainly determined by the politicians, to be specific. As clinicians, we do have a role, but it's limited. It's mainly the politicians' business to address some of these issues. But even saying it belongs to the politicians, as an individual, you have a great mandate on this one. By the mere fact that you are joined to this presentation, it shows you have a great value on your health. Someone is out there, just ignored it. But you have decided to set aside some time and say, let me just hear on what these people are saying. Because we say these things are on daily basis. We are very passionate about these things. We share it with others, but it takes one to say, I want to listen to what this person is saying. Then primary healthcare is also based on the application of relevant results of social, biomedical, and health services, research, and public health experience. Yeah, so it's again greatly linked to public health. The policies that will be implemented by the ministry at ministerial level, those are the ones which mainly determine this. To say, we think back when HIV came, people had to sit down and say, we think there's something that's going on out there. Let's find out, let's research what it is. And then they found it's HIV, and they said, probably if you had to tax everyone from what they earn, you deduct $1 or $2 and put it towards HIV. We are not only treating those people, but we're also preventing these illnesses coming to us. And even big nations like the USA, they do support. They have various programs which come in and support to say, please deal with this pandemic before it comes to them. So then public health, primary health care addresses the main health problems in the community, providing promotive, preventative, curative, and rehabilitative services accordingly. So it's not only a matter of preventing, but it also deals with health promotion, curative to some extent. You can actually go to a clinic having received a cut or from somewhere for a metal object. Then you can get your tetanus there, you can get your dressing there before you move to the next level, where you can. And by the way, most of these primary health care, they do not have a doctor, especially in Zimbabwe. They actually don't have. You get to see a doctor when you move to the secondary health care, like a district hospital. There, that's where you can get to be seen by a doctor. But by the time you get to a primary health clinic, you are assisted. If you're having a cough, they actually get to test you for TB, for COVID, and the like. By the time you move to the next level, you probably have been treated to some extent. And also, because these things are interlinked, at the primary healthcare referring to the secondary healthcare. Let's say we have treated you and you think that you are stable, we can refer you back to the primary healthcare to get a rest of your treatment, like your ARVs. There's no need for you to keep on coming to the hospital, which will be probably 50 to 100 kilometers to get your ARV. If you are just stable, you can get it from your local clinic. And primary healthcare also includes at least education concerning prevailing health problems and the methods of preventing and controlling them, promotion of food supply and proper nutrition, an adequate supply of safe water and basic sanitation, maternal and child health care, including family planning. Yeah, so all those things you can get at a primary level. I'm trying to avoid maternal and health care because it's really a big topic to discuss on, maybe for another day, but maybe today you can just focus on the supply of water and the basics. But family planning you can also get from a local clinic before you can have problems with unwanted pregnancies. You can just have access to family planning method with a local clinic, as long as you're self-determined and you're willing. Yes, let's move to the next one. So the other thing is immunization against the major infectious diseases, prevention and control, like what we have just been mentioning. And the other point is public health, primary health care should be sustained by integrated, functional, and mutually supportive referral systems, leading to the progressive involvement of comprehensive health care for all and giving priority to those most in need. Yeah, so before we can flood hospitals, I think there's need for some screening at a local clinic to say this we can deal with it here. If it's a matter of malnutrition, a child who's not doing well, they go for scales from time to time. And then they are even given supplementary feeds and the like. But then the primary health care, then they say, this thing now needs the attention of a doctor. That's when they can actually refer you to a district hospital or a provincial hospital, something like that. Then that will be the secondary healthcare. And then at the secondary healthcare, let's say if it's an example of a maternal case, is a pregnant woman who has been seen not to be progressing well at a local clinic, they refer to a secondary level at a district hospital where there's a doctor who can now attend and we probably do a cesarean section. Then if there's need to escalate the condition, they can even refer to the tertiary hospitals, which are your central hospitals. In Harare, we have Parenyatkwa group of hospitals and Salem Gabe Hospital, formerly known as Harare Central Hospital, or Bukomu, like what it's popularly called. Then primary healthcare relies at local and federal levels on health workers, including physicians, nurses, midwives, auxiliaries, and community workers as applicable, as well as traditional practitioners as needed, suitably trained socially and technically to work as a health team and to respond to the expressed health needs of the community. So like we've been mentioning, it's teamwork to say it, the grassroots. You can have your community workers, they can actually respond to an emergency. If it's in a malaria case, before you even get to the clinic, they have given you some treatment and they can test, they're trained and all those things. They even keep with them some essential drugs which are life-saving. So in your communities, but this is mainly in the rural areas, people just rush to the community nurse and then they are given the treatment before they are referred to the next level. Yes, maybe we can move to the next slide. I'll move to the next one. Okay. This also is a bit summarizes what we've just been mentioning, that it's preventative, promotive, curative to some extent, rehabilitative, and supportive for individuals and family communities. But the main focus for primary health care is on the preventative aspect. Next. Yeah, so these are some of the elements that you can expect to get when you visit a primary healthcare facility or a clinic. We expect you to get health education, your maternal child health care, prevention of illnesses, prevention and control of endemic diseases, treatment of minor injuries and illnesses, sanitation, adequate and safe water supply, promotion of mental health, adequate nutrition, provision of essential drugs, and your immunization. So a basic clinic can offer some of these services. Yes. Next. Okay. I move to the next. Next. Okay. Yeah. So these are some of the principles of primary healthcare, where we have equitable distribution, where we have health services should be accessible to all section of society, with people with special attention to the need, vulnerable groups. This has actually been termed as social justice, where we want people who are in the urban, in the rural, everyone should just have access to healthcare. And we also have community involvement. Since primary healthcare is for the people, by the people, the local community must participate in the planning, implementation, and maintenance of health services. So you as the community also have a role to play in primary healthcare. Yes, next. Then appropriate technology. Instead of going in for positive methods, equipments, and technology, reliance must be placed on scientifically sound materials and methods that are socially acceptable. For example, oral rehydration therapy. So these are simple but very effective and have been proven to work. So instead of people going for traditional healers and the go-goes in the villages to say, I don't know if it's a common practice somewhere, when a child has sunken fontanels or and then they're scratched on the fontanels and the like, instead of people just getting some oral rehydration for the child who's probably having diarrhea and the like, and then they work. People, I don't know why they choose to do the less effective or something that's not proven to work, and there are things that are proven to scientifically work at a free cost actually. Then we have prevention. The emphasis is on prevention. This I have mentioned quite a number of times. And it runs through all the elements of primary healthcare. Then the multi-sectorial approach we have mentioned, whereby we need different sectors to come in and play their part to ensure that health is accessible for all. Okay. We have community participation is the process by which individuals and families assume responsibilities for their own health and welfare, and for those of the community, and develops the capacity to contribute to their and country's development. There's a saying amongst doctors and nurses which goes, drugs don't work if we do not take them. So as a community, we have a mandate to actually take these things, take up these vaccinations, take up these protective way, take up all those things that are given to you, your mosquito nets and fumigation and spraying of homesteads to prevent malaria and the likes. So it comes back to the community. Yes. Next one. Okay, maybe we can move to the next in the interest of time. Okay. Yeah, so I've mentioned the referral system, get to a primary level, and then the clinic will call the hospital to say, maybe can you give us an ambulance with an emergency here? So the most important thing to do whenever you have an emergency or if an illness is to present to a local clinic, and then do whatever you have been told to do. Like I've mentioned that in our setup, we might have issues to do with resource. Might be told the ambulance is there but doesn't have fuel. Please, if you can get the fuel and move to the next level. Because in an emergency, it might be an issue of minutes, seconds. hours that determine the outcome. So, but the most important thing is to present to a local clinic and do as you are told in the quickest possible manner. I'll give you an example whereby someone was a farmer. He was bitten by a snake in the bush. He did not manage to identify the snake, but I think people just suspected that it would be a black mamba. And then this person went to a clinic. They did well on this one. And then at the clinic, they were told by other patients before they were seen by the nurse to say, if it's a snake bite, don't even attempt to go to a clinic, go to a traditional healer. He will give you some traditional herbs. And they went there. They were given the traditional herbs. Then 4 hours later, they came back to the same clinic. They said, we've been referred to the traditional healer who stays down there, but the condition is now actually worsened. That's when they were told, but you had an emergency, you had already came earlier, but now you have actually delayed. By the way, just go to the next level, to the hospital. Then we saw them 4 hours, I think it was 6 hours later on. Now they were very sick. They wouldn't even talk. We tried to give them antivenom and the like, but we're not able to save the life. But if they came earlier and did the correct thing, we probably could have saved, because we have actually quite a number of victims who survived this, some of the worst snake bites. Then we have the logistics of supply, includes planning, budgeting of the supplies required, procurement or manufacture, storage, distribution, and control. This is just technical. Again, move to the next. Move to the next. So we have mentioned the levels of healthcare. So from primary, a good example is a clinic where you get the basic services. And then you are referred to the secondary level if nurses feel that your condition needs a doctor to attend to you. Then the secondary level in our setup is a district hospital. That's where you can get to be attended by a doctor. Most of our district hospitals, they do have doctors, and from there, there are also levels which you can get to find at a secondary level that you are not able to find at a primary level. That's when you can get even more and more sophisticated investigations. But then if the secondary level or the district hospital is not able to handle your case, they will also refer you to a tertiary level healthcare. This one, that's where you can get to be seen by specialists, the likes of provincial hospitals, Paranaatwa, Bindura, Marondera. Every province has got a provincial hospital. And again, if the provincial hospital feels a condition needs to be escalated, that's when they can refer you to Paranaatwa and Salangaba Hospital for Harare. In Blawa, there's UBH. There's also Mpilo. And in Chitungiza, there's Chitungiza Central Hospital. These are the central hospitals now in Zimbabwe at the moment. Okay. And most of these tertiary level healthcare, they're actually teaching institutions. That's where you get most of the teaching happening, where you have doctors trained and the likes. Yes, we can move to the next. Move to the next. All right, that's fine. Maybe just to the secondary level. The previous slide. Yes. So at this level, you have more complex problems taken care mostly, which require secondary level preventive services and curative services. These services are provided at district health centers or hospitals. Those cases which can be handled at primary or community are referred to district health centers. And then we can move to the next one. Then this level of healthcare is provided at the state, regional, central level institutions. These institutions serve as referral units for primary and secondary levels. They also serve as teaching institutions for education and training of various categories of healthcare professionals. Okay. All right, next one. Next one. I think we've come to the end of this presentation on primary healthcare. Just move to the next. Yeah, that's the end of the presentation on primary healthcare and secondary healthcare. So I don't know, presenter, if the time allows, where I was supposed to touch on the general well-being, the general healthy, before we go into the question section.
Hello, Doc. Yes, you can take a few minutes to get into that.
All right, maybe before that, can we have a break? I think it is stopped raining outside. Just a 2 minutes break.
That's all right.
Okay.
As you take the 2 minutes break, I'll be busy discussing with them about what they learned about this primary health care. So we will just wait for you.
All right.
Okay, dear Dynamites, please let's get through the chat box. If you have anything to say, you can raise your hand and you can tell us what you heard from the doc himself, what you heard about health, and what you are going to do to ensure that the people in your community are actually living and leading a healthy life. So is there anyone who wants to say something? Okay, I don't see any hands yet. Pastor Munashe, maybe you could tell me how this session was for you.
Yeah, thank you very much, Praise. For me, this session has been very informative. And what I really enjoyed or liked about this session is the emphasis of the participation of the community. That's what I really liked on primary health, care. In most cases, as especially Zimbabweans and as Africans, we actually think that, or we are schooled to believe that provision of healthcare at an individual level, a provision of healthcare in our communities is a government role. It's a government responsibility. But from this presentation, what I'm taking, the doctor mentioned about that multi-sectoral approach for us to be able to achieve that level of health that we all need to be part and parcel of. So I'm talking here about how different sectors, you might be in accounting, you might be in logistics. I know that there are some here who are going to be graduating as business managers, those who are studying business management, for example, and those who are going to be graduating here as chartered accountants. What role can you play in your community through the company that you have, through the employment that you have to contribute? What can you do as an accountant? What can you do as an engineer? What can you do as a sports person to ensure that your community lives a healthy life? And then in our community, we mostly think that provision of healthcare is, you know, the local council and the like. We do not, and us, especially us young people, we think it's the role of the older generation to be doing that. But the doctor here emphasized on community participation, meaning from individual level and you as a family. For example, where do you throw your rubbish? Most of us, we just go across the street, or there's that corner in the community where everyone knows it's a dump site, but it's not a designated dump site. So you as a family, what do you do with your rubbish? You as an individual, what do you do with that freeze-it paper of yours, or that donut paper of yours when you're done eating? Where do you throw it? You know, so I like that emphasis on multi-sectoral approach, which speaks to our professions, right, as dynamites in our specific professions. Then the community participation, starting from individual, going to family, and the community at large. So I really enjoyed that, and it was a eureka moment.
Thank you so much, Pastor Munashe. I can see that you were really, really paying attention to this session. I also love that part where you talked about community participation. You know, when you were talking about us throwing our rubbish just anyway, you know, when we were growing, we were told that the like your nearest bin is your pocket. You get to eat a sweet, you get to put that wrapper in your pocket. Then when you get close to a bin, that's when you throw that paper in the bin. So it's really wonderful that we had someone to come through and really tell us about these things. And us as dynamites on the platform, we were learning, we were listening, and I could see a lot of comments in there. People saying following, learning, taking notes, what. So people, let me get to hear what it is that you are following, what it is that you are learning. Let me get to hear it. So let's keep the comments coming in the chat box. Let's raise our hands so that we get a chance to say whatever it is that we learned in this session. I'm giving you a moment, guys, to just tell me what you learned. Oh, I see there's a Liberty there. Liberty and Tinashe. Let me just ask you to unmute.
Good afternoon.
Good afternoon.
Good afternoon. I'm quite good. So I hear the categories of healthcare: the primary healthcare, the secondary level healthcare, then the tertiary. Then on the primary, you mentioned about prevention, treatment, and management of illness, sort of STIs, HIV, and the like. Then on secondary, you talked about the complex problems, those let's say those illness that can be handled by big hospitals and in clinics like Impilo, Chitungwiza General Hospital, then Parire Nyatwa. Then on tertiary level, you talked about the regional. So those ones that can be handled. Let's say the training teams that can be sent actually in areas like rural areas to train in schools and the like. That's what I just heard from Doc. Thank you.
That's amazing. Thank you so much for such an amazing contribution. And I see that Doc is back on the platform. I'm getting this time to you. Over to you, Doc.
Well, it's just amazing how people were following up on. I thought it was a bit technical, but I think people are getting the message. I'm impressed. You know, it's really good that people are following the presentation. So for this other part of the presentation, I do not have a presentation to share with you. It's mainly going to be a bit interactive because these are day-to-day issues that we are faced with. So we just need to probably put an emphasis on some of these issues, because people already know these things. So the second part is on the physical healthy, and just the general well-being of a person. So it's quite a broad talk, but just decided to pick on 4 things, which are your physical healthy, physical activity, the mental healthy, and dietary issues, as well as sexual health. It's very important that we talk on these things. So for the physical healthy, we need to have exercise programs. All right, just a minute. All right, sorry about that interruption, but I was talking about physical activity, whereby there's need for people to be physically active on a daily basis. At least a 30-minute time period of just physical activity, and this needs to be aerobic exercise. Whereby you can get to breathe in and breathe out a lot. A good example is running, sport activities, playing football, swimming, and the like. You need to incorporate it into your day-to-day schedule. Because some people might say, I have a busy schedule, but there's need for you to incorporate these things into your busy schedule. Because before you may know it, you'll be having many illnesses such as diabetes, hypertension, obesity. Right now in America, they are battling with obesity because people are living sedentary lifestyles. So let's say you have a busy schedule, you're a chartered accountant, like you have mentioned, that some amongst the audience will go on to be chartered accountants, businessmen, whatever. So you may just do something as simple as parking your car probably from the furthest car park or carport. Then you walk from there to your office. Instead of taking lift to the 8th floor, you actually take the stairs, just to ensure that you are healthy and you are doing physical activities. Weekends, just find a hobby, a sport that you can play on weekends, and so that you just keep yourself physically active. Then with that, I think physical activities also linked to dietary. So I'll just go on to the issues of diet, where I would just like to emphasize on the need to stay hydrated, especially this summer, because you might just feel like, I'm not well, I'm being lethargic, when it's just an issue of dehydration. You need to take in lots of fluids and to ensure you stay hydrated. We can't really say someone needs to take 2 liters of water, because these things are dependent on your body weight. But on average, you just need 1.5 liter to something like 2 liters a day. You are warm and dry and you are hydrated. And also these fluids also take into consideration, like tea that you'll be taking, soup from your feeds. They also go on to say to keep you hydrated. Some might think I'm forgetting beer, but it's not like I'm forgetting it, but it's not really part of the rehydration therapy. So yeah, from time to time, people need to take in you know, I don't know how you're reacting wherever you are, but people around me now they're a bit unsettled. I don't know why, but yeah, beer. There's a moderate quantity that you need to take. Well, you can always look up this information as to the number of units that you can take. Because we might recommend 2 units of alcohol, but you need to know what a unit is and when to take in a week. I also recommend the number of days that you need to take in a week. I'm forgetting the exact days, but it may be 2 in a week, and you need to take 2 units probably. Then these units depend, because you can say a glass of vodka is equal to a glass of chibuku, you know. So it depends with the amount of alcohol that's in the beer. But one or two, in moderate quantities, alcohol is fine, but just don't overdo it, because it's got its own complications, which has got to do with poor performance at work. There are a lot of accidents at work and even on the road. So you just need to take a moderate amount of alcohol. Then you also need to eat more at home, unlike going out from time to time, getting those fast foods. Therefore, they are huge amount of fat content and too much salt. And yeah, in the end, you get a lot of fat in your body, and it comes with a lot of problems like strokes, heart attacks, a sudden death. You hear someone who's fat, they get a cardiac arrest, because that fat will be taking, will go on to block the blood supply to your heart, if you got the coronary arteries, and even the blood supply in the brain, and end up with a stroke, which can give you permanent disability or even death. So you need to monitor your diet, especially in these times, whereby people are living sedentary lifestyles. These lifestyles, they do not find time to cook. But when you cook at home, you actually see that you put good ingredients in there and moderate, and you take a moderate portion of it. But when you go and buy out, you get 3 pieces of chicken, and you're thinking that if I don't take them all, I will not have done justice to the money that I have paid. But when you're at home, you can just decide to cook 1 piece of chicken leg and you like, and then you stay healthy. But and maybe we'll move on to the issue of mental health, which is actually a very, very important issue, given the amount of suicidal cases we've seen in the past years, especially amongst men. I don't know what's going on, but you need to be able to communicate your problems with others. They say problem shared is half solved, which is true. Because often at times you might think that I have reached a dead end. There's no tomorrow. I don't know what's going to happen. People hear this and this. But if you share with others, they'll probably have gone through what you are going through. They'll tell you how they have handled such situations. So you need to have good family support with others. People nowadays in this global village, we have brothers in the UK, sisters in America. But let's embrace technology. You can just do a family conference and get everyone to join you on the call and vent out and tell them your problems. And you say, hey guys, before I decide to kill myself, you always say you care about me. I think this is time for you to chip in. Just now I saw the name that was saying, guys, give me my $300 that you intend to put on my tombstone so that I can eat it or spend it now while it's time still alive. Then if I die, I can just put probably a metal sheet over my coffin, because it won't be meaning much when someone is dead. But when you are alive, if you get to share your problems, you can just call, it's especially for me, you can call me anytime, and then we share your problems and see how we can help each other. Or even if someone you're close to, be it a pastor, you can just give them a call and say, I'm not doing well, I think I'm so low, please keep me. So let's really take care of our mental health, and let's avoid situations which are stressful, you know. And let's just try to live within our means, in this tough economy. People try to live a flash life on social media, and like, just try and live within your means. If you are earning 200, there's no way out you can rent an apartment of 400 or something. But you just need to be open with yourself and say, yes, I think I can afford to drive the fuel saver. You can't get a GT6 for now. Don't be like that forever. But just take it step by step. You get there. Remember, Rome was not built in a single day. So you just need to be doing the correct thing on a daily basis. And they say if you want to do the impossible, just start by doing the possible on a daily basis. You end up doing the impossible. And lastly, but not least, I'd like to talk on sexual health. This is a very important issue, especially given the audience I'm addressing. I was told I'll be addressing mostly students from tertiary institutions in Burundi, South Africa, Lesotho, the like. So in this world, for AMA 2000, where things are happening pretty much fast, there's need for us to be sane for a minute before we do what we do, and think uh, think outside the box, and just take the necessary precautionary steps before you sleep with someone. Don't be quick about it. Test each other for HIV, and be open with each other. But I think after what we're doing, what we're ringing out, certain years, I might be tempted into sleeping with you. Maybe let's pass by the shop and buy some protection. Yeah, nowadays people are really open, they speak out their mind. Unlike back in the days where people would hide their intentions, and when before they know it, they get someone pregnant, and it comes with this on the target, you're carrying a baby before you plan for it. And nowadays, with HIV, you can contract the disease. But we also need to be a bit scientific about it. Nowadays, even after sleeping with someone, you can get post-exposure prophylaxis, where you can just get in the pharmacy, the course you need to take for about 30 days. You will be taking a drug, which is literally antiretroviral therapy for 20 days. This you don't even know someone's status. You just take it and you prevent yourself. But before you take it, you need to test yourself, see that are you not already positive, so that if you're positive, you can just take it for life and get to live your normal life. If you take your ARVs in time before HIV complicates in your body. And also, if you think that you're probably going to live a risk life for a coming period, Maybe I just say, I think I need to have pre-exposure prophylaxis. I'm going to be having a high risk behavior for the next 2 months. You can take this medication on a daily basis and you have unprotected cells and still not contract the disease. It works. So it just needs people to be open with themselves and know what they want. And also to have contraception. You can say today it was a mistake and you take a morning after. And tomorrow again it happens, you take another morning after. I think it will be just good for you to be honest with yourself and say, I need a long-term contraceptive methods like a Depo, a Jatel, or a Loop. There are many different options out there. So, yeah, I think that marks the end of the presentation. Thank you very much for listening.
Absolutely, doctor. Just a quick question. And I really enjoyed this conversation and this talk, and I liked that you were really practical in your approach to this conversation, especially the scientific approach to it. So I'll just come in as a pastor there, and I will be saying, ndinoda kuchatisa vanhu vasati vasangana nemurume kana nemukomana kana nemusikana kana nemukadzi. Handiti kavana vangu, ndoda kuchatisa vanhu vakachena pamberi paMwari. So I appreciate what Doc has said, but I would like to encourage you abstinence. I'd like to encourage you abstinence. And then you mentioned about alcohol. For us Christians, Doc, do we have any options of how we can get whatever we need to get in our bodies, which is not beer? Because I know it's a very controversial issue, even in my church, concerning alcohol. Well, I don't know how do you see that as we come to an end? Are there any other options that can assist us?
So I didn't quite get your last question. Are you saying is there a substitute for alcohol, or I didn't quite get that?
Yes. Is there a substitute for alcohol, especially for us Christians who don't believe in taking beer?
Okay. Well, I wouldn't say it's a substitute per se, but I do also come from a Christian background. Remember, in the Bible actually says some small amount of wine is good for the body, because actually alcohol do clears some fat in our blood vessels, but it should be in very small quantities. But I wouldn't say it's a reason enough to take alcohol. I think if you think it's not good for you, it's still best you don't take it. Some even wine, as long as taken in few quantities, is still good for the body. But you can actually do well without these things. I wouldn't know if there was certain substitutes per se, but probably exercise, dieting, and yeah, I don't know if maybe my other colleagues who are on this platform might want to chip in on that one. I'm not sure on that.
Thank you very much, Doc. I don't know if the other colleagues are chipping in. I can see Ivan is saying, okay, Ivan, you're saying small amounts. Okay, that's perfect. Okay, I wanted to read out some few comments out there, but I think, Doc, thank you very much. And one thing that we hadn't mentioned, Dr. Tawanda Zvakada is one of us. He's our older brother. He was on the Joshua Nkomo Scholarship, and he is one of our most trusted Joshua Lights. And thank you, Doc, for taking your time out to come back and give back to the platform that contributed to your journey to get to where you are. And I'm sure that your talk today is going to help someone. There are some Joshua Lights that I hear who are starting their first year, who are in their second year. I mean, here is an example of what you could be. You could become Dr. Tawanda yourself in the next 5 to 7 years. So thank you very much, Doc. I will hand over this time to Praise to close the session for us.
Thank you so much, Pastor Menashe. And thank you so much, Doc, for taking your valuable time to talk to us, to speak to us, and to enlighten us on primary healthcare and all the other levels of healthcare that we just learned about today. We really appreciate you. Thank you so much once again. Please do find some time to come through again and speak to us. We would love to have you once again on the platform. And to aspiring doctors on the platform, dear Dynamite, I'm pretty sure that you've learned a lot, and you can all agree with me that this session was really insightful. There are no announcements for this week, except that Young and Dynamic continues next week, same place, same time. Tell a friend to bring a friend and bring another friend, and be here at 3:45 sharp. That's it for this week. Goodbye.
Yeah. Yeah. You're a man of your word. Yeah. Yeah. Here we go. This is what it says. All things are possible when we believe. Old chains are breakable when we receive your way. You keep your promises. If you said it, we believe it. If you said it, hey. If you said it, we believe it. Hey. Yeah. If say